Appendicitis is one of the most common general surgery emergencies. There is a very good chance that you have seen someone in your friends, families, or if you have had appendectomy done in the past. It is very important to understand if that's the case, how to deal with it and how to respond to appendix emergency. Appendicitis is the inflammation or obstruction or infection of the appendix. It can present with acute severe pain and it can wake you up in the middle of the night. It can cause vomiting, it can cause severe pain in the right lower quadrant of the abdomen, the stomach. As we discussed in the video, it's a surgical emergency, so you have to respond fast. You have to take the patient directly to the emergency room of the hospital. In the emergency room, the physician is going to perform some exams, which are the first one, psoas sign. We raise the right leg against resistance, and if you feel pain, that's a positive psoas sign. The second most common test is obturator sign. That's the internal flexion of the right hip, and if the patient feels pain, that's a positive obturator sign. We can perform some labs and see if the white blood cells are elevated because of the infection. The most sensitive and most specific test to perform is CT, the computerized tomography of the abdomen, to see if the appendix is inflamed. The walls of the appendix is over 2 millimeter thick because of the infection or inflammation, or if the appendix is over 6 millimeter in size, that's a positive appendicitis case. The most successful and most common treatment of appendicitis is having a surgery done, appendectomy done. The most important thing to understand and to not forget at this time, if you have a positive case appendicitis, you do not eat or drink anything before seeing a doctor. The reason being, if you have to go through appendectomy, you will be under general anesthesia and you can have vomiting during the procedure, which is not very desirable. Appendix can happen anywhere in the ages 15 to 45. Men and women equally susceptible to the disease. Appendix can happen due to several reasons. Something is stuck in the appendix, there's an inflammation going on, there's an infection going on. Thank you for watching. Please share and subscribe.